Potential cuts to research budgets are now causing concern across academic and scientific communities.
As Mike McDaniel explains, that research, which could ultimately save lives, could be slowed down or ended altogether if cuts go into effect.
Inside Tulane University's School of Medicine, medical research is a big part of every day, especially in the areas of infectious disease, heart disease, and cancer.
Research is one of our three key missions. Education, obviously, also clinical care, and the third, very important, is research.
Like most university leaders, the dean, Dr. Lee Ham, is paying close attention to what could be a drastic cut in federal research funding from the National Institutes of Health.
Anything that you sort of spend less on, over time, you're going to get less of. So that's one of the scary things.
Part of the Trump administration's plan to slash federal spending includes a cut to indirect research costs down to 15%. That money from the NIH pays for things like utilities, staff, and equipment. Tulane currently has a 53% rate, which would create a big gap.
For a medical school in particular, the NIH is by far and away the principal source of funds.
According to United for Medical Research, Tulane University is the top NIH-funded institution in Louisiana. Dr. Ham says there's about $130 million in NIH funding across Tulane. Somewhere between 60 and 70 million is in the School of Medicine.
So without these additional funds, the research has to slow down or stop.
Heather Pierce with the Association of American Medical Colleges says she's optimistic a court ruling putting the cuts on hold will eventually prevent them from ever taking effect.
Slowing down research, stopping research, telling people they can't enroll in clinical trials, that has an impact that goes far into the future.
I could not be prouder of the faculty at LSU with respect to what's happening on research.
LSU President William Tate says the university has broken research records over the last 3 years with a historic high of $488 million in research activity. In a statement, Tate said LSU has about $192 million in NIH funding and that without sufficient support, life-saving discoveries will stall and research institutions across the state and nation will face crippling financial shortfalls.
Research can't be turned on and off like a light switch.
Pierce says it goes beyond just institutions.
It impacts jobs, it impacts the economy, and most importantly, it impacts the hope of the patients and families that are looking for and relying on medical progress.
Progress that happens every day, but could be in jeopardy if federal funding is drastically reduced.
The university would not be able to support the level of research that goes on. You just can't afford that.
Mike McDaniel, WWL, Louisiana.